Everyone, welcome. So just to introduce myself, my name is Mandy Larson. I am the Suicide Prevention Regional Response Coordinator here at Capital Health Network. And thanks for everyone for joining today. Just our acknowledgement of country. We begin today by acknowledging the Ngunnawal people, the traditional custodians of the land we're meeting on, and recognise any other people or families with connection to the lands of the ACT region. We wish to acknowledge and respect their continuing culture and the contribution they make to the life of this city and region. We'd also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending today's event. And we acknowledge the individual and collective insight and expertise of those with lived experience of mental ill health and suicide distress. The lived experience stories and insights have informed and impacted all we do for this program. So just a session overview for today, a bit of an introduction to who we are and what Capital Health Network is, and then a background on TRISP, on the TRISP funding and what you're all here joining us today, and a bit of the ACT context, and then what the procurement process itself looks like, the key criteria, and the timelines, and then at the end of the presentation, we'll do questions. We'll answer the questions that have been put in the Q&A box. And as I said before, please note that we are recording the session. So I've introduced myself. I'm Mandy Larson. I've been lucky enough to be part of this project for the last, I think it's 9-10 months here at Capital Health Network. And I'll just let Steph, my manager, introduce herself.
Hello, everyone. My name is Steph Linton. I'm the manager at CHN of the Mental Health and Suicide Prevention Program, and I've been working with Mandy on the TRISP program from that level as well.
Mamta?
Hi, everyone. My name is Mamta. I'm the senior manager here for the health system integration team. Thank you.
And Sharon.
Yeah, good afternoon, everyone. My name is Sharon Storr, and I'm the procurement and contract lead here at CHN, just working with the team through this procurement activity.
Thanks, everyone. Okay, so and just what Capital Health Network actually does, we are the primary health network for the ACT, and PHNs, or primary health networks, have been established by the Australian government with the key objectives of increasing the efficiency and effectiveness of health services for patients, particularly those at risk of poor health outcomes, and improving coordination of care to ensure patients receive the right care at the right place at the right time. As you can see on the right-hand side of the screen there, CHN, or Capital Health Network, meets these aims across 9 priority areas. And I think we know that individuals can be in many of these different priority areas. And our focus here today is those at-risk populations. So those in those at-risk populations, where did TRISP come from, and what does TRISP actually mean? So just to give you a bit of a background on that, it came out of the National Mental Health and Suicide Prevention Agreement, where all governments committed to working together to really reduce the fragmentation between states and the Commonwealth, to address the gaps that are there, and to prioritise investment in prevention and early intervention. And it was built off a lot of the learnings from the National Suicide Prevention Trial, which involved about 12 PHNs, primary health networks, and it involved the ACT, and some of you may remember ACT was involved in the Lifespan trial a few years ago. And what governments, Commonwealth and state, came to the conclusion of was that we do need to be do more in regards to suicide prevention initiatives. but they're going to look very different between a remote area, or a remote geographical area, and a metropolitan area. And they're even going to look very different to areas that are next to each other. So I think the key word in all of this is regional. So TRISP is the acronym, so Targeted Regional Initiatives for Suicide Prevention. We need to look at what's happening locally to know where we need to focus. And that's happening in all the 31 primary health networks in Australia. It's had its funding from the Department of Health and Ageing, and in 22-23, a national budget of 42.3 million was provided to PHNs across the country. And part of that funding is to have one of me in every regional response coordinator in every primary health network, to work with the community in establishing a collaborative, which we have done in the ACT, which is a great segue to the next slide. So from October last year, we've set up the ACT Regional Suicide Prevention Community Collaborative. Like I said, had its initial meeting in October 2023. It's a really diverse group of community stakeholders, government, lived experience members of our community, and service providers. And from that, from the feedback from that collaborative, it's really informed us as to what the local need is, and therefore the writing of this RFP, or of this request for proposal. And what was highlighted as the areas of need, or populations of need in our community, is these different groups of our population, our at-risk population. What we really highlighted were those Canberrans who are currently in suicidal distress but not accessing mental health services. So they're not currently using services in the ACT for their mental ill health, but they are suicidal and aren't seeking help. So there's that really big gap there that we really wanted to concentrate on. And as I said before, you know, these are different population groups, but of course, one individual could be in several of these groups, putting them at greater risk. So the TRISP funding for the ACT, as you've probably read, we have a total of 410,000 to fund an initiative or initiatives in the ACT for the next financial year, so July 24 to June 25. The RFP, so request for proposal, the information, as you've probably already obtained it, is, and the application is on the CHN website. It doesn't have to be $410,000 initiative that we fund. It could be a lot of smaller initiatives, but the maximum amount, so the total that will come to, will be 410,000. That's not to say we wouldn't fund an initiative for 410. It just depends what the assessment panel review as the most appropriate application for our area. So the assessment review of the applications will be a panel of experts from Capital Health Network. We will have a lived experience person of suicidal distress, and we'll have suicide prevention specialists on that panel. And as I've sort of talked about before, focused on the unique risk factors for our area and the at-risk populations in our local community, especially those not currently connected with mental health services. So the scope of activities, that which will benefit those in that group, or those in a multitude of those groups. something that strengthens communities and family. And what we mean there is, we know in the ACT and in any community, we have a lot of people that are isolated and not connected to community. So strengthening that community building, and and that connectivity within the population, and also strengthening it through the workplace as well. So it could be related to training or compassion of staff to support those people that are feeling suicidal. To be safe and effective, so we're funding for a year, so it does need to have an effective element to it, addressing the local service gaps, and a minimisation of duplication of other services. So services coming together to collaborate is something that we'd really encourage, but it can't be a duplication of services that we already have. Directly linked to suicide prevention, intervention and postvention. So it could be that awareness around suicide prevention and what that looks like, or it could be support postvention, because we also know that that's an at-risk area for those grieving or bereaved by suicide. Ability to be sustainable beyond the funding period is something, the sustainability of the program is something that we are looking for, and we really encourage creativity, ideas that might be a bit different, ideas from smaller community groups, willing to accept anything that might be new and a bit different, but that's not saying that we won't support or fund a program that's already in place, but may want to increase hours or staffing or those sorts of things. So the beauty of TRISP and the beauty of this funding is just how incredibly flexible this is. Out of scope, I think I've touched on this, but initiatives that are outside the ACT, it has to be within our ACT border. Proposals under $10,000. So it has to be above $10,000, minimum and maximum of $410,000, and duplication of current services. The assessment criteria, and I won't run through all of this because you probably have seen it in the application. I suppose what's really important is the word count here. We will only read up to the maximum word count. So anything, if you put in under the proposal qualities and attributes 2,000 words, we will read up to the 1,500 words. So just to make that really clear, that we will be maintaining that maximum word count for equality. And also, I suppose the other thing to highlight is just the weighting section there. So the 40 and the 25% for innovation and sustainability, pardon me, are really important factors to take into account there. In the RFP, I think it's on pages 4, 5 and 6, there are examples of what you could, programs or initiatives that we could fund. They are examples. So we just really wanted to highlight, and it does say in the RFP, but they're only some ideas that have come out of our collaborative, and to give you some taste of what we're looking for. It's not an exhaustive list, so please, if you're thinking beyond that, that's great. We're certainly willing to look at innovative ideas, as I said before. So who can apply? Any individual, organisation, community group or service provider can apply for the funding. The initiative which the organisation or community group proposes must be provided within the ACT, and all applications will be treated with the strictest confidence. So the timeline for this, so the RFP opened on the 29th of February. And the question and answer period will close on the 22nd of March. So that's not this Friday, the following Friday. So we need any questions that need to be answered to be either emailed through to the tender inbox or answered here today. You've got up until the 22nd of March, though, to if something comes to mind, just please email it through. The RFP itself closes on the 5th of April, just after Easter. I think it's the Friday after Easter. And the assessment panel application review. So the panel will come together about mid-April to assess any applications that come through. That will then be announced probably the end of April, beginning of May, and contract negotiations will go through in May. And then we need the initiative operational for that financial year. So from between July 24 and June 25. At the moment, that's when the funding does finish, June 25. We've all got our fingers crossed it might go for longer, but that's what we're looking at presently. So just a summary for you. The request for proposal is open now and will close the 5th of April, 5 p.m. Questions can be emailed through to the tenders inbox anytime before 5 p.m. on the 22nd of March. And the briefing session question and answer, so any questions that come up here in this forum, plus any that come straight to our inbox, will appear on the Capital Health Network website. Any previous discussions that we've had in that long acronym there, but that's the ACT Regional Suicide Prevention Community Collaborative that I spoke to before regarding the TRISP RFP, will also be made publicly available on our website. Okay. So I'm going to hand over to Steph now. And she can open up with any questions that you might have.
Thanks, Mandy. We're starting to get a couple of questions coming through. We'll just give it a couple of minutes before we get started onto answering those, just to give everyone a little bit more time to put their questions in the Q&A. So please get started with doing that now, and we'll come back in about 2 minutes to start answering those. Okay, so first question we have is, please could you elaborate on how an application might demonstrate sustainability beyond the funding period? There is also a similar question that says, when you say sustainable, are you expecting organisations to fund their initiatives after the 2024 to 2025 funding period is over? I'm going to hand over to Mandy to answer that first question, or those two questions.
Okay, so just in regard to the sustainability question, something that might, and this is just an example, please, that might be sustainable longer term could be, for example, workplace training that an organisation might invest in to train their staff members in suicide awareness or suicide prevention skills, and then that goes beyond the life of the 12-month scope of the training. Yeah, we don't, it'd be an ideal world, I presume, I would say, if we could suggest that you could fund beyond that period. And in some circumstances, maybe it is, but it could be something like a community group that, that does a suicide awareness campaign in their called community or something like that. So just that, that education goes beyond the 12 months because it then flows down through the community. Steph, did you want to add anything to that one?
No, I think that's a good answer to that. We're happy to expand on that more as well, and that will go on the Q&A document online. So if you would like to refer back to that one, that will be there as well. We have a question from one organisation who does have initiatives that already exist in the ACT. And the question is that if more of these initiatives were to be started in different areas within the ACT, would this be regarded as duplication? So the answer to that would be no. Duplication would refer to sort of an unnecessary replacement or using services that we already have that are meeting needs. If this application was able to demonstrate that what is already there is not entirely meeting the needs, and that there are people who aren't currently accessing the existing initiatives that would benefit from expanded initiatives, or if expanding the initiatives would mean that more people would be able to access services who are at risk, then that would certainly be okay. So duplication would only be if it was adding to existing services that would not add anything, if that makes sense. And apologies, there is another similar question saying, when you say not a duplication of an existing service, I assume it would likely be okay to be an expansion of an existing successful service. And yes, that is correct as well. Apologies for missing that just then when talking about duplication. Yes, so a service that is, for example, one example of that would be a service that has a limited number of operating hours, initiative to expand those operating hours to capture people who would not be able to access that service within its existing operating hours would be fine. An expansion of the services provided within an existing service would be fine. So that is certainly okay as well. There's a question asking if there are any risk models that we need to adhere to. We're not fully across what you might mean by that question. Could the person who asked that question please elaborate on that or provide some more information in the Q&A? Thank you. There's a question saying, you note the vulnerability of certain populations, for example, veterans, LGBTQIA, etc. Do you know how many of each died by suicide in the ACT in preceding years? What about people discharged from mental health services? This person has noted that this is to help allocate resources across prevention efforts. This is not data that we have on hand at the moment. We will look into it if there is available data. I can say that in the ACT, the data about deaths by suicide is incredibly limited due to the small population here, so it can be quite hard to stratify that data across population groups. But we will look into what data we do have available that is able to be shared, and we will answer that question on the Q&A document. Thank you. There's a question asking if there's a strong request for peer workforce recruitment to roles. I'll pass over to Mandy to answer this question.
Yeah, so we would consider the development of a peer workforce or upskilling of a peer workforce as something that would be would fit into the funding for this program. Certainly upskilling of any workforce in regard to suicide prevention, but noting that a peer workforce is really important in the context of the world we're living in and that lived experience. So yeah, that would certainly fit into this realm. Just in regard to, I think the risk models have come through and just some clarification on that in regard to calling emergency services and collecting names of participants, clients. It would depend on the service that we're looking at. There would certainly be, like all suicide prevention services or programs, there would certainly be an element, a duty of care element. But we'd have to look at the initiative that you're speaking to get some further clarification in what's that in regard to. When we're dealing with people in community that are at risk, we certainly need some sort of risk mitigation, but we don't have a particular model that we're working towards.
I'd also encourage everyone to refer, which is referred to in the RFP, to the PHN standard terms and conditions for information about what goes into the contracts in terms of what needs to be adhered to within PHN contracts, which does include certain standards and certain guidances that need to be adhered to as part of primary health network funding, which may provide a little bit more information about that as well. There's a question asking if an organisation can submit more than one application. I'll pass over to Mandy to answer that one as well.
Yes, certainly an organisation, a community group, an individual can submit more than one application, that's fine, but they do have to be done on different RFPs. So they would have to be individual RFPs or an individual application process.
There's a question asking how we will send out the link to this recording, and I'm going to hand over to Sharon Storen to answer this question.
Yeah, so once the recording has been finalised, we will upload the link onto our website for everyone to review, and the link will also be sent out to all the participants that registered for this briefing session.
Mandy and Steph, looks like there is no further questions.
We might wait 2 or 3 more minutes
No
just to see if
yeah.
any further questions come through. And if we have no further questions, we'll end the session there. Thanks. A question has come through asking if we would consider development or upskill of a peer workforce to be part of a sustainability strategy. Yes, I think that would definitely fit in with what would be considered sustainable, as that would be something that would have an impact past the current 1 year funding, as it would support that workforce development that would not have been the case prior. Okay, looks like we've got no further questions, so we might end the session there. I'll just hand back to Mandy to close off our session today.
Great. Thank you, Steph. Thanks everyone for your time this afternoon. Thanks for your support of our local community and the care and compassion and the good work that we're all trying to do to support those who are in suicidal distress. As we said earlier, if you do have any other questions, please pop them through our email inbox, and all questions and answers will appear there up until the 22nd of March. You can ask any more questions, and along with the recording of today's session. Okay, wishing everyone well. Thank you.